Hi, everyone. Welcome to the Iowa Hunger Coalition's August 2024 monthly meetup. Great to have you all here today. Please feel free to drop your name, organization, where you're joining from in the chat. I know I've said that like 6 times already, but we've got some folks just coming on, and we will go ahead and get started. We've got a few things we want to cover today. First, for those of you who might be new to the Iowa Hunger Coalition, just a brief introduction. We are a membership-based 501c4 organization. We have a volunteer board of directors. My name is Luke Elzinga. I'm the board chair of the Iowa Hunger Coalition. Other board members, maybe drop that in the chat or wave. We do have a contract lobbyist. John and Cindy Peterson are our lobbyists at the State House. And we really try to be that organization bringing individuals and other organizations together to address food insecurity and build equitable food systems in Iowa through education, advocacy, and policy change. This is our mission and guiding principles, which we've developed over the past year. Thank you for everyone who provided input in that process. And our mission is working to end hunger in Iowa through education, advocacy, and policy change rooted in justice. Our three guiding principles are hunger is a policy choice, nutritious food is a human right, and ending hunger requires solidarity, not just charity. And if you want to learn more about those guiding principles, you can just go to iowahungercoalition.org. Right on our homepage, there's some more explanation behind those. Fun news, if you haven't seen, IHC is getting a ray gun shirt. These will be coming in September. We had kind of a pre-order, but if you missed that, do not worry. You'll be able to order a shirt directly online from Raygun. And so we're really excited about this and hope that it helps bring awareness of the organization, as well as raising some funds. Real quick, I wanted to mention this. This is not an IHC event, but this is something that went out yesterday. And I just wanted to share with everyone. There is an upcoming town hall with USDA Secretary Tom Vilsack next Thursday in North Liberty, Iowa. We're going to drop the registration link in the chat. You do need to pre-register to attend by next Monday. So I just wanted to share that. It's a great opportunity to hear from the secretary. I don't know if there will be a time for a Q&A, but I think just to weigh in on what we're seeing right now with hunger and food insecurity in the state. So I just wanted to share that. All right. Brief update on summer EBT. There's a lot to discuss here, and we're actually not going to spend too much time on it. First, I want to say a huge thank you to everyone who signed our petition. We had over 4,000 signatures and reached out to the governor's office in support of summer EBT. It was very clear that we made our voices heard. We had a blog post out about those signatures with a zip code map. You can clearly see this has broad support across the state. There's some really powerful quotes that people shared when they signed the petition. I really encourage you, if you haven't had a chance to read that, check it out and kind of read through those. So the decision was not exactly the one we had hoped. The governor basically said, we're going to request a waiver. Instead of using these funds for summer EBT, we want to run this food box distribution program. I think we have a lot of questions about that, and it's also not clear that USDA will grant that request, but we want to look on the bright side. I think in the release, the governor and our state agencies publicly acknowledged that Iowa is facing a hunger and food insecurity crisis, that we have food banks, pantries, other emergency feeding organizations across the state that are really being pushed to the brink right now. And seeing that publicly acknowledged, clearly we made our voices heard. They also recognized in that release that many Iowans who face food insecurity are not currently being served by nutrition programs, which I think gives us an entry point to some policy proposals that we've been pursuing for a while, including raising the income eligibility for SNAP to 200%. This new program they proposed was 200% FPL for the income qualifications. It's clear they recognize there's a lot of Iowans who need to visit food pantries, who face insecurity, and those programs are currently out of reach. So I think we'll have some ideas for them there. I also want to say this is not over. You know, this August 15th deadline was simply to put us in the best spot with implementing summer EBT for 2025. It would have allowed us to start drawing down those administrative funds, get the program set up for next year. But we have, as a state, until January 1st to submit a notice of intent to USDA to participate. So we have time. We are making plans. This is not the last you've heard from us. And we'll have a lot more to come in the coming weeks on this. Also wanted to provide just a few SNAP updates. Just a reminder, Iowa Hunger Coalition has a great tool on our website, just called the SNAP Map. And we pull monthly data from the state and try to track the trends. This is going back to 2003. So the part here on the right is more current. We've kind of been at a plateau in SNAP enrollment for the last 12, 18 months. I keep wondering if we're going to see it edge up, go down. You know, July was about 1,000 more people than June. Still not clear if that's going to be a larger trend of upward enrollment, or this could be kind of a seasonal blip and we see it, you know, go back to static or fall. So it's a little early to say. I will say if you go to that map, you can look at county level trends. A lot of counties continue to see decreases. Dallas County by far has seen the most increases. Polk County is also trending upward. So I always think it's best to look at that local data because that gives you a better idea of what you're seeing in your part of the state. Another announcement on SNAP, USDA released the cost of living adjustments for SNAP for fiscal year 2025. These are based on food prices in June, and it's a whole complicated formula that I won't get into, but it's based on the Thrifty Food Plan, which we've talked about before. And the bad news is that this is one of the smallest cost of living adjustments to SNAP in recent history that we've seen. The minimum benefit will remain at $23 per month. Families receiving the maximum benefit will see their monthly benefits increase somewhere between $1 and $4. A couple dollars more if they've got households greater than 5 or 6. I think probably most households will see their monthly benefit increase by $1 or $2, if at all, which doesn't provide a lot of help for families who are, you know, struggling with food costs right now. But that's the formula, you know. this is all based on USDA's formulas for this. Another update on SNAP. I know you guys love it when I get into the weeds on SNAP policy, so I'll try not to bore you to death. There's a recent metric that came out from USDA for application processing timeliness for fiscal year 2023. Iowa's APT for fiscal year 23 was 77.7%, which is the lowest it's ever been dating back to 2011. And this means basically that only 78% of SNAP applications were processed in the 30 days required by federal law, or 7 days for individuals who qualify for expedited services. So around 3/4 of SNAP applications are being processed in a timely manner, but that still leaves a whole lot of people who are left waiting with their applications and waiting for a decision to be made. I think another concerning piece, this is more recent data from the USDA Midwest Regional Office that is showing a couple, I think, good things, positive things. Our payment error rate in Iowa continues to fall. That is a good thing. It seems like we've made some progress in application processing timeliness compared to that fiscal year 23 data. But there's this concerning metric around recertification processing timeliness. This is our people who are recertifying, not applying for the first time. That timeliness is at about 73%. So that's another concerning metric for to be aware of. All right. You've heard my spiel on Snap. Today I'm really excited. We are have a couple guest speakers. Karen and Marie will both be talking with us about WIC and sharing more. And so I am just going to hand it over now to Karen Goff to share with all of us more about WIC.
Thank you, Luke. This is my dream. This is my passion. So I could talk for a long time, but I will just try to keep it as short as I can. So on the next slide, I just wanted to explain or just kind of show you who is WIC. And it's a program, and our goal is to safeguard the health of low-income women, children, and babies, and too, who are at nutrition risk. And we do provide nutritious foods. We're a supplemental food program, and also lots of education and information as far as healthy eating, toddler, preschool, nutrition during infancy, and also, prenatal and postpartum. And also we do a tons and tons of referrals to healthcare. So on the next slide, exactly what is WIC? So this is kind of the official description, I guess, of what WIC is in the federal. It's a federal grant. It's all federal funds, federal money. Again, and it goes to the states, and then our job is to provide the services and the foods, again, supplemental healthcare referrals, and education. So who is eligible? Our program is at the 185% of the federal poverty. So for instance, a family of four would be 57,000. And also foster children under the age of 5, all the various medical Medicaid waivers, including if they're on waiting list, and our SNAP families, our Head Start families, and also our Medicaid families are automatically eligible for WIC. So if we have a family that's not participating in one of those programs, then that's where the 185% federal does come in. So on the next slide, this is what we really do. We families, and I'm going to read this because this is just families are trying to make it through the day. Their time and navigating being parents, being moms, being dads, being grandparents, being guardians, being foster parents, and just we're in a crisis then too, and struggling from to jobs, and all the different levels. And they want they're all trying to do their best to feed their families in the best way that they know how. Very limited resources, very cooking skills, and also just nutrition knowledge then too. So families can help, kind of rely on us, and we can help families how to stretch those food dollars, and making, obviously decisions on budget, meal prep, shopping at the stores, and also how we connect our families to the different resources within their community. So this is what we do day in and day out. Now, on the next slide, we're going to have a little history lesson here. I there's a lot of stuff in here, but I just wanted to show you how the complexity of it is for the WIC funding to get to the local level. So it starts in October, which will start next year, and making plans for fiscal year 25. So WIC is a discretionary program. It's different than SNAP and Medicaid. It goes through annual appropriations. It goes through the different appropriation committees in both the House and the Senate, and then there's the subcommittee. So it has to go through all of that. And this kind of gives you a timeline of where this is supposed to happen. Now, in a perfect world, this is what it looks like. However, it never works like this. We're never like, it rarely happens like this too. So when the budget isn't completed by October 1st, which is just a few months away, month and a half away, then it goes into what they call continuing resolutions. And that is so we're not going to be shut down. So we will continue to get funding based on last year's funding or amounts, and then so we can keep moving forward with the program. So we're not having, again, to shut WIC completely down. So sometimes, and it can take a whole year to do this. And and also then sometimes WIC, this our appropriation funding and our levels gets wrapped into other bills to make sure it gets passage. So we lose some of our funding because we'd rather have some than nothing. So often we probably do not get the full funding of what we're asking for, but at least we get some of the funding. So now that it's gone through all the at the federal level, so now it's let's say we have a budget now, and then on the next slide, then it talks about so what's happening at the state level. So we only get our funding on a quarterly basis. So of that fund, of that grant, the amount for there, 75% of it goes for the food that will be distributed or will be on the food packages that the participants will receive. And then the other 25% is more what we call the NSA, or the Nutrition Service and Administration grant portion of it, and that's where we administer the program. We manage it. We're promoting the breastfeeding support, the education, all the client services. So a majority of the money does go. So we have the food money to provide to as many families as we can. So there's not a waiting list there. No, we have this funding now, and 20% of it, 25% of it is for the NSA. So of that 25% of it, 20% of it by law has to be on nutrition education. So we have to, all the documentation that goes with that. At least right around 10% is on breastfeeding support. And then also the rest of it is for client services. So it's broken down into kind of like line items. And so we have to ensure by federal law that, let's say I get $100, so 20 prints. So I have to prove that I spent, 20% of that was on nutrition ed and 10 on breastfeeding and so forth. Then two. Once in a while, we do have some infrastructure money, and that's additional money that might be left over maybe from last year we didn't spend, or maybe Ohio didn't spend all their money. So it kind of goes into the regional pot. And so we can get some infrastructure money. And I'll kind of show you what we've done with some of the infrastructure that my local agency has done. For right now, Iowa, as far as the amount that we get, is right around between 15 and 16 million. And then that is divided between the 15 agencies that contract with HHS to provide WIC services throughout the state of Iowa. And in my local agency, we're serving 4 counties right here in central Iowa, which is Dallas and Polk and Warren and Madison County. So on the next slide, I kind of wanted to show you what our food package is. And I rounded it up to 70, sometimes it's 66 point, $66.36 or something, but I just rounded up to 70 because I wanted to show you how it can help on a monthly basis. So if 2 people were on WIC for 1 month, that's $140 that they would that they could use at the grocery store for the different foods that are on WIC. And so if there are 2 people on WIC for 6 months, let's say there's 1 person on WIC for a whole year and 2 people on WIC for a whole year, how much that can help with cost savings in the food budget. And again, this is supplemental, so it's not providing all the milk that they'll drink and everything like that too. So I just kind of gave you an example of what a typical food package for a child is. And so the milk, the cheese, the yogurt, the tofu, that's kind of all kind of in the dairy. So, and there's over 2 dozen variations in these food packages based on what the family, do I want milk? Do you want some cheese? Do you want yogurt? Would you like some tofu? So there's lots of different options of how we can create that food package for that. I did after I sent this to Luke, I thought, oh, on the cereal, they get more than 3 ounces of cereal. I don't think we can find a box of cereal. It's supposed to be 36 ounces of cereal. So that so this just kind of gives you as far as what what they would get in a healthy food package. Now, these foods were selected based on research and tons of research on what macronutrients and micronutrients are missing in like in a child's diet. Obviously the infant formula, and also breastfeeding and pregnant women. So that's why these foods were chosen. I will say everything on here is quantity. So if a gallon, so with WIC, it kind of helps because if a gallon of milk is $4 or if it's $5, they still get that gallon of milk. So that comes out of when on the previous slide when we talked about out of the foods funds. So that's where that money is coming out. The only thing that is not quantity and is based on dollar amount is the fruit and vegetable. So so each child that is on WIC will has for the month $26 that they can buy in fresh and frozen fruits and vegetables. It doesn't go very far nowadays. It used to, but not anymore. Than two. So that's why we work with families and kind of getting and so there's not wastage and so they're using it and so we're getting these foods into their into the household and hopefully they're using their benefits at the store. We have Out on the cereal for the 36 ounces of cereals, we have mm, maybe 20, almost 30 different kinds of cereals. And the cereals, again, are selected based on nutrient. It has to be, the iron, and it has to be meet the qualifications for iron content. It has, low sugar content, making sure that the B vitamins are there. So it's a scientific food package there too. So almost like a food script then to what we're giving to our families. So um, so that is kind of in a nutshell as far as what WIC is federally then too. I'm going to kind of bring it down to again on the next slide to Iowa. The state of Iowa did this study, and the name of the report is Iowa Estimated Eligible Population. We wanted to see how many are we serving, how many eligibles are there that are not being served, and and so we're to use this as kind of a challenge, like for my local agency. So where are our families and how can we reach our families and what can we do in the community to be a part of the community so we are much more accessible and visible than two. So I'll drop down to the last one, which is I thought we were doing a better job, I guess, than two, but less than half of the Iowa residents that are eligible for WIC are participating in the program. And of that population, it's pregnant women and children. So that's is kind of our call and again, our challenge. So we need to find where we need to go to serve. And this is throughout the state of Iowa. And obviously, in my 4 counties also, pregnant women and children. And so that's what this report's done. We're using it for lots of, and there's a bunch of data in there too that will help. I can tell you just in my 4 counties, I have over I have 13,000 individuals that should be on WIC that are not using WIC and too. So again, we've got some work to do and need that. On the next slide, I wanted to show you, this talks about food security, and this is among just Iowa WIC, not Iowa general, but just our WIC families there too. So this is this kind of a map that shows you as far food insecurity by county, and I will break it down here a little bit more on the next slide there too, some of the highlights there too. So we did this survey back in 2021, and that was was COVID, but we did not we didn't just rely on just on COVID. We just wanted to know just food insecurity. So and this is like 46%, and this is again of Iowa WIC participants were food insecure at some point, and almost 17% of our WIC families are very low food secure, which is the most severe form, and which means that there was not the eating patterns were disruptive, reduced intake, mom wasn't eating, dad wasn't eating, they were adding water to the milk, adding, adding lots, water to the juice to thin it out, and then to make it meet till the end of the month until they can get their next set of benefits too. So, and then the last one too was in the past 12 months, household members, did they ever cut the size of their meals? And because there wasn't enough money for food, 26% ate less than they felt they should. And then again, about 28% didn't have enough money for food then too. So I can tell you from the experience, I've worked with WIC for a long time, and this is my typical WIC family. I participate in WIC. I go to the food pantry. I get what SNAP I get, and and then I go to, maybe my child is in Head Start, and then I am in another community service where I'm trying to find additional food boxes. And when you think how many places these families have to go to find food, and the time and the red tape they have to go through, I have to apply for this, I have to apply for here, I have to go over here. I mean, they're spending 5 different places so they can find food for their family for for 1 month, and doing that month after month, and always. And then there's housing, and where is my money going to come for my gas so I can get to the different appointments. I don't have enough gas. I don't have a car. So it's it's heart-wrenching then too, to try to help the families as much as we can. So, and again, like Luke said, this is statewide. This isn't just, in my little corner of the state, but it's statewide then too. Now, on the next slide, this is my caseload here at Broadlawns, and you can see it jumped a lot in January 2024, and it has stayed there. So it's an uptick. And so and I don't see this going downward at all. We're having a hard time kind of keeping up with new families that are coming on WIC all the time. So I just wanted to, and other agencies throughout the state have the same, a very similar graph that they would show and too. So, again, I thought we were reaching our families and thought we are doing a good job, but no, we still have a lot of work to do then. So on the next page, I kind of want to show you, this is some initiatives that the state is doing. So we're talking about some of that infrastructure money. So we are been piloting with a WIC online shopping. So WIC moms or families can shop online, and our partner right now is with Hy-Vee. So we're working with Hy-Vee so families can select their food items, their WIC items online, and then they can go to the store, to drive up to pick it up too. So we just started that in February. So, and again, it requires technology. Not all of our families are tech savvy, but our families that are, it does, help with picking out, making sure you've got the right what kind of cereal, because not all cereals are on WIC, and as far as milk, what am I supposed to buy 1% milk or whole milk? So that WIC online shopping does kind of help kind of narrow that a little bit. Then so there's not as many errors going error or embarrassment maybe at the checkout and there. The health information exchange, we're working with Sync Health, and that is so if a family was a little one was at the doctor for their 2-year well-child checkup, and then they're coming to WIC a week later, that we have access to some of that anthros and some of the medical information, so we don't have to duplicate and repeat it all over again. Then too, we do have a WIC shopper app again that shows families what foods they have and when they go to the store and then what foods they have left. So it kind of take the guessing game out. And also they can scan the food, like say a box of Cheerios. Is this WIC approved? Can I purchase it? And so we'll turn green. And if it goes to like I kind of there's so many different kind of Cheerios, so not all Cheerios are WIC approved, but so they can figure that out with their WIC app. And then also we have WIC Health Online, where families can, it's a resource and families can look for, and we refer to it all the time, nutrition education and links and so forth, so they can learn a lot about shopping, infant nutrition, when do you start solids, a lot of that education there too. And our newest one is what we call telewic. It's our version of telehealth, but it's telewic, so we can do appointments by the phone. And again, for families who don't have transportation, I'm working 2 jobs. I don't have the time to get there, so we can do some of that on and do that virtually, trying to do it virtually and then also on via phone, so they don't have to bring their little ones. Say if a pregnant mom is bedridden during her pregnancy, or we did a lot of this during COVID. So if a little one's sick, then we can do this appointment over the phone too. So this is a link to for WIC at the state level. And I thank you for supporting WIC. We can't do this on our own. We rely on our communities and our partners and our friends and stuff. So we definitely want to get our families on WIC then too. So, but thank you.
Thank you so much, Karen. That was so informative. Really appreciate you hopping on to share more. Next, we are going to have Marie from the National WIC Association talk more about WIC advocacy. But real quick, are there any questions for Karen at all? Kathy?
There we are. Yes. Is the online shopping and the telewic, is that statewide or is that something that your particular agency does?
It is statewide. Yes, it just newly statewide. So we're, yeah, very excited with that. So we're getting used to do, as far as showing families and how online shopping, because you have to create, it's not as easy you think it is, because you have to have your WIC account, then you have to have the Hy-Vee IELTS account. So you have 2 accounts, and so just to show that the education and showing families how to do that. But so
Wonderful. Thank you.
yes, thanks, Kathy.
I had a
Karen?
quick question, if that's okay. Oh, go ahead, Nicole.
Sorry, John. I was just going to ask, for those of us who, see families in other situations, what would you recommend for us to, to increase referrals or to help them connect with WIC or get signed up for those that aren't being served?
At my local agency, we have, and I can give that to Luke, but we have a website, web page, so you can send just like a referral. You can apply on WIC, and let us know when would you like for an appointment. Do you want an in-person appointment? Do you want us to do the quote, the TeleWIC, and we can call you? So we have online. And I think if you just do, and also you can use this, the link that I put here as far as statewide, that will take you to the local agency, whether it's a phone number, but we have a website and stuff too that you can link or can click on.
My question is kind of similar, but thank you, Karen, for the enlightening information. And maybe this will be touched on by our next speaker too, but I was curious, in your opinion, what are some of those barriers to participation? You noted like half of those who are eligible aren't enrolled. What in your mind is keeping folks from getting enrolled in this really vital program?
We're not accessible in the community. You know, we have a clinic here and a clinic there. We just expect families, you know, come and find us and come to our clinic. But it's the resources. A lot of it is transportation is huge. I'll say some of our rural counties in Iowa, I'm there once a month. I'm there maybe the third Wednesday of the month. And then if I can't go that third Wednesday, I'm out until next month. So that's where the accessibility and I will say, and then Marie might help me with this, maybe back me up, lack of technology. WIC, we're trying to get kind of up to par here because I've worked with WIC for 40 years and the last 20 years we really haven't done much. So it's real exciting to see that some of that infrastructure money I was talking about is there now, and we can pursue opportunities and stuff of how we can need to get into the community and meeting families where they are. And one of the projects we use for infrastructure was we're purchasing a WIC mobile unit, so we can take that fully functional WIC clinic out into the different communities, different neighborhoods. We can go to the farmers market, we can go to neighborhood associations, and we can provide services right on site, right there, so families aren't trying to figure out how to get to a WIC clinic.
I see another question.
I just realized, so hi, I'm Emily Meister, actually, not Kayla Rome. And I just realized I must have joined using her link. I thought when the camera was off that she was on too, until I realized that's me. Anyway, sorry about that. My question, well, just one comment. I don't know how many years this has been the case, but I'm very glad to see the WIC card. The e-WIC card rather than the old voucher system. I know when my kids were young, I have two boys that were really close together and we received WIC benefits and we used them because they were very valuable. I dreaded it. I would go to the grocery store at like midnight when I knew no one else would be there and there wouldn't be a line and I wouldn't hold it up. So I think that's great. But when we're talking about some of the barriers, I think that there is still a really significant stigma attached to WIC benefits, even more so than SNAP benefits or maybe even food pantry use. Because I've personally, been in a grocery store where a checker has, been very unkind to a shopper using WIC benefits or calling for the manager in a really sort of public and humiliating way. And I wonder, how can we as like a coalition help address that from an education standpoint, from the way that you explain it, this is a very scientific, this is the best nutrition, right, that we can offer to young people or pregnant moms. What can we do from that communication standpoint to help people feel more comfortable using the program?
Education and going with the families to the store, because we've from my experience, we've had families that did not use a card for the exact same reason that you're talking about. I went once, I was totally embarrassed, and so I'm not going to do that again. So if I can go with that family and show how this works, and we've done that, and the next time all the benefits are being used. So it's making sure that they know which ones of those foods are approved. And that's what that's why we use that shopper app. We said, just scan that thing. And if it'll turn green. If it's green, we're good to go. If it's red,
Mhm.
then it's not WIC approved. So we're trying to do that. We're also creating kind of like a tutorial or a YouTube on just walking through every kind of like mapping out what it is to be how to shop and using those benefits at the WIC store then too. But I'm right there with you. My family, we were on WIC when my children were younger, and those WIC checks and stuff too. And I remember them throwing their hands up and whack, like that then too. And you just want to hide then too. So, but it takes, I'd say some talent to making sure that you know which of these WIC, what foods are WIC approved.
All right, thank you. I love all these questions. I do want to move on to Marie just so we've got enough time for her and we can circle back. So if you've got questions, post them in the chat or hold on to them. And then after Marie's presentation, we can come back to those. So I want to turn things over to Marie now from the National WIC Association. And feel free to take it away.
That was such a great presentation, so thank you so much. Especially how you went over the appropriations process. That was very impressive. So thank you so much for that. Hi, everyone. I'm Marie Gualtieri. I'm the Advocacy Manager at the National WIC Association. For those of you who may not be aware of the National WIC Association, we are the education arm and advocacy voice of WIC. So the over 6 million women and children that are in the program, as well as the 12,000 service provider agencies and their staff. So anyone from the people greeting you at the door to the state directors who are implementing the program at the state level, that is who we serve. Next slide, please. So in terms of advocacy and WIC priorities, Karen really laid such a wonderful foundation for both the appropriations process and the WIC food package. So I will kind of go over where we are now with those and how you can get involved. So for the FY25 appropriations process, it's usually kicked off by the release of the president's budget. So the president budget included $7.7 billion for the program. And this is usually a projection from USDA on what is the participation that we expect and how can we have funding that meets participation rates so that no eligible family is turned away. So the president's budget came out, and then that's when the House and Senate start putting together their proposals. So in the House proposal, they included $7.2 billion for WIC. So it's below the president's budget, but something that they wrote in report language, which is basically like you have the bill with all the numbers and funding in it. And then there's something separate called report language, which is just language where you could direct an agency to do something like a report or a study or show commitment to any sort of priorities that the members may have. And so in the report language, it included that the Appropriations Committee will work closely with USDA to ensure that they, at the end of the process, have the money to, or provide the money that USDA says we need to meet participation, because sometimes it can fluctuate from their projection. So that is a really good commitment, something we haven't seen before. So while it's 7.2 billion in the House proposal right now, you know, that added commitment is reassuring. Now, the House bill has been through the subcommittee and the Appropriations Committee through what's called a markup process. So that is when anyone wants to change something to the proposal that was released initially. And usually that sets forth its ability to be, to go on the House floor for a vote. So it goes from committee to like this markup, right? and then to the House floor for a vote. And we thought that we would see a House vote on it before the August recess, where members of Congress go home before coming back in September. However, that did not happen. It was supposed to go to the House floor for a vote, but it was pulled last minute. Usually that happens when they know that they do not have the votes to pass the bill. We do not believe that WIC was the reason why they didn't have the votes. There were other things that were either in the bill or not in the bill that members wanted. And because of that, it didn't go to the floor for a vote. So members will come back in September and we shall see what the House does then. On the Senate side, they put in or provided $7.4 billion in new funding for WIC. So on their base bill or proposal, it shows the 7.7 number that matches the president's budget. But when you look in the bill, it has a $300 million rescission. So that's why we say that the Senate bill provides $7.4 billion in new funding, because with that rescission, you know, it's not necessarily all of it, right? And so for us, we are, you know, hopeful that, you know, things will work itself out. The Senate as well has put up the commitment that they will work closely with the USDA to ensure that the final number in the appropriations bill that passes ultimately will have the number that they need to fully fund WIC to meet participation rates. And so both of these commitments on the House and Senate side are reassuring, but we want to make sure that we continue to keep that pressure up because sometimes people can forget their commitments if they're not reminded. So that is why advocacy is so important. Now, the WIC food package plays into the appropriations process just a little bit. So the WIC food package, as Karen went over so eloquently, is really just this science-based nutritional standard that really has shown such positive outcome in the nutrition and health of women and children enrolled in WIC. Now, the WIC food package every so years goes through a review process, and then changes are made. So we are thrilled that in April 2024, a revised WIC food package was announced by the USDA, and typically the states have about 2 years or so to fully implement the changes. And so while we know what the changes will look like, the changes will come, you know, in the coming years rather than right away, because there is a lot to do, and Karen can attest to this. There is a lot to do to implement these changes, and we are so grateful for the staff that really work hard to do so. So we're really excited for the changes that are coming. It really creates more flexibility, more choices, more culturally relevant foods for families. So it's really exciting. It really meets families where they're at. Now, how this plays into appropriations is that sometimes members of Congress, even though we have this process that for what's called rulemaking, which is how these changes happen through the agency of USDA, and they, you know, take in public comment and go over those comments before releasing the final changes, right? Which happened back in April, as I mentioned. So members of Congress sometimes will see those changes and they might want to tweak them. And so in the House proposal, not the Senate proposal, but in the House proposal, there are a few what they call riders that impact the WIC food package. Now, these riders are things that are just separate from the bill that, again, their language, right, on specific changes that some members might want or have prioritized. And so in terms of this appropriation cycle, there are 3 riders to make note of, and that is requiring USDA to add peanut butter or peanut containing foods to infant food packages. So there are peanut containing foods in the older children's food package, but not the infant ones currently. And so they want more of an early introduction of peanut containing foods. And so that is one of the riders. And then the next one is changing the amount of fluid milk provided from the final revisions in the WIC food packages. And then the third is requiring state agencies to authorize all forms of fruits and vegetables. So that includes dried, frozen, canned, and fresh. And so these riders, it doesn't mean that they'll make it into the final package, but something that we want to make note of is, our priorities is that WIC is fully funded to meet the participation needs so that no eligible families is turned away. And then on the side of the WIC food packages, there is a process. The process has happened, and already state agencies are implementing these changes. So any interruption to the WIC food packages and the implementation of that is actually going to be really detrimental to the rollout and to these staff that are doing such wonderful work and trying to implement these changes. It's an added burden, and we don't want to cause that. It can also cause confusion among families themselves. So we really want to avoid any sort of things that could interfere with the implementation. And like I said, this implementation can take, 2 years. And as Karen mentioned before, in a perfect world, these bills would be passed by September 30th, but we know that that's not the reality that we are faced with. And so because of that, a bill could be passed like last year. It wasn't until April that an agriculture appropriations bill was passed. So that was very far into the year. So if we think about if that were to happen again, I'm not saying it will, but if that were to happen again, that's already a year into the implementation of these food packages. So it would be a real disruption, and we do not want that. And so, so those are our two priorities that we are focused on here at the National WIC Association. And so, yeah. In terms of the appropriations process as well, I just wanted to let you know that when members come back in September, they will be in a race to pass something by that September 30th deadline. As Karen mentioned, we will most likely see a continuing resolution, which will just bring the current levels of funding out to another determined date to give them more time to pass the bill and come to an agreement. We don't know what date that is yet, but we'll keep you in the loop as the process unfolds. Next slide, please. Thank you, Luke. Okay, so how you can get involved. So we have here at the National WIC Association something called the WIC Action Network, and it is a series of bi-weekly calls that keep you in the loop of what's going on in Congress and what pressure is needed. And so this is open up to people who are WIC staff, but then also outside of WIC. So anyone who has a real passion for WIC and cares about WIC can join us. I did create 2 QR codes here on the slide. One is just a video of the WIC Action Network to learn some more information. And then the other QR code is a link to the meeting registration itself. I'll also follow up with Luke with a link to the meeting registration so that if anyone is having trouble with the QR code on their phone, or I'm going too fast, then you'll be able to receive the link if you're interested in attending those. So next slide. And then we have action alerts here at NWA. So currently we have an action alert that is basically a pre-drafted letter bringing up our two priorities. So the letter that is pre-drafted by me is asking Congress to ensure that they continue to work with the USDA to create a number in the final appropriations bill that we know will fully fund the program in terms of participation so that no eligible family is turned away. So that's priority number 1, that's in the letter. The second priority is about the implementation of the WIC food packages and how we do not want any interference in those. So, opposing the riders that are presented before us in this current process. So basically, you're probably like, what do these pre-drafted letters do? So when you fill out the form, you fill out, an address, which will then link it up to your member of Congress, specifically in the House and Senate. And so the letters will be sent to them once you click submit. And from that, what we're trying to generate is the more letters sent to the members of Congress, the more that in their letters system, which is called IQ, it will kind of just flag it that, wow, you're getting a lot of letters about WIC, right? And they have what's called a legislative correspondent, which is the person who reviews a lot of these letters before taking them to the member of Congress themselves. And so if they're seeing a lot of letters on WIC, when they're talking to the member of Congress, they're going to say, we're getting a lot of outreach about WIC, and this is what people are saying, and this is what people want. So we're trying to generate as many letters sent as possible to these offices. So that way, we can generate that flag that we want. So that way members of Congress know that their constituents are reaching out about WIC and they really care about that. So when they vote for the appropriations bill, or, members of Congress talk, the next time they talk to an appropriator, or they might be an appropriator, to make sure that WIC is protected, WIC is safe. So those are 2 QR codes. The Take Action Today link is a link to the pre-drafted letter itself and the form to fill out. And then the second is a social media toolkit. So feel free to get on social media and tweet out, or Facebook, or whatever avenue you use for your social media, Threads, whatever. I don't know. I haven't explored Threads yet myself, but just getting the word out there to make sure that WIC is really top of mind for people, and just showing how much love and care people have for the program. It really does matter. I'm a former congressional staffer, so I know how the voice of constituents and just the power of voices can really have on the sway of the action taken by members of Congress. So those are the actions we have. Also in the chat, I'm going to put some resources that we have on the WIC food package. We have like a fact sheet talking about the different, the changes that just came about, and some of the events that we've had that are recordings and things like that, if you're interested in clicking on those. Next slide, please. And that's it. So I put my email there just in case if you have any questions for me after this presentation, but I can take questions now as well.
Thank you, Marie, so much. Really appreciate you sharing. Please know you have a network of advocates here in Iowa. Send us action alerts. We're happy to send them out through the Hunger Coalition. Encourage people to attend those bi-weekly calls. I try to attend when I'm available, and they're always super informative. So really appreciate it. Part of the reason why we wanted to talk about WIC was we knew we're going into September with the CR, so it was just the perfect time to hear from you, and really appreciate that. So we're kind of out of time. If anyone has any burning questions, though, I will see if we have any. Otherwise, Marie's email is here. Please reach out. And yeah, I'll be taking a look at that social media toolkit too to see how we can help spread the word. So thank you.
Thank you all so much. Really appreciate it.
Thanks, Marie. All right, real quick, we're about at the hour. Just a couple ways to stay engaged with the Iowa Hunger Coalition. We do have a couple committees. We have our Outreach and Membership Committee, which is meeting this Friday at 10 a.m. Let us know if you'd be interested in joining that. We've got some exciting things we're planning. We'll be talking more about those ray gun shirts. And then our Policy Committee meets next Tuesday at 1 p.m. and we'll be finalizing our legislative priorities for Iowa's 2025 legislative session. Also want to share that we are starting to plan some regional gatherings for IHC. We'll be out in Council Bluffs in September, hoping to host something in Cedar Rapids in October. And this is something we want to do going forward to continue building on our network of advocates, learning from people across the state and just making those connections. So these will be in-person regional gatherings. And if you'd like us to come to your community, please drop us an email and let's talk. Few ways to stay engaged and connected. Sign up for our email newsletter if you're not already. Please share with others. You can like us on Facebook. We do have, if you really like emails from me that like are in the weeds on stuff, you can sign up for our Iowa SNAP Advocates Google group. It's basically just a listserv where we share recent news updates. And we can add you to that. And join our monthly meetups. You're here in August. We'd love to see you back in September. It's the third Wednesdays of the month at 10 a.m. Always encourage people to become a dues-paying member of IHC. You can be an organizational member. You can be an individual member. It's our membership dues that really make our work possible. And just wanted to close with a thank you all for being here. I'm going to stop sharing my screen now. If people want to hang out for any questions, I don't know if Karen and Marie have a couple minutes, but if you have to drop off now too, that's fine. Thank you so much for being here. But we'll stick around for a few if there are any lingering questions. I am not seeing any, so
Yeah, I got one,
I'm
Luke.
gonna.
I have a
Oh yeah,
question.
John, go ahead.
Yeah, thank you to you and all the presenters today. I'm really appreciated this information. Do you have any idea when the USDA might respond to the Iowa waiver request on summary BT?